Alrighty, Ray, you, CARE, group of companies, thank you so much for coming in and talking to us today.
That's right.
Health has been on the top of so many people's minds for the last couple of years with this whole fiasco that we've had to go through, which has been difficult on many. And more importantly, mental health, which is a big pillar that you guys touch on. So what I'm going to start with here is just kind of tell us a little bit about CARE group of companies. You guys have 3 pillars that you focus on. Can you kind of take us through all that?
Yeah, absolutely. And thanks for having me,
Absolutely.
Bryce. It's great to be here in person, right?
Yeah.
And yeah, it's been an interesting, couple years to say the least, and quite challenging, right? For I would say all aspects. When we look at our organizations as a whole, whether it's primary care, the medical clinics, and the pharmacies, there was a lot of adjustments that we had to make. In terms of CARE, we really focus on the utilization of technology to basically improve access to better mental health supports.
Yep.
And then the other aspect that's very important is that integration, right? When somebody is able to access, our system or the ecosystem, if you will, to ensure that they're being taken care of, it's not kind of like a one and done sort of thing when it comes to mental health. That ongoing support, access to resources is extraordinarily important. And so for us, when we built the organization, fortunately, this was before the pandemic, and it was, we've been in the space for quite a while in the shape and form of, physical bricks and mortar, medical clinics, pharmacies, wellness centers, and that sort of thing. And so what we looked at was we said, okay, we help a lot of people. We're able to, expand through that route. But when you think about mental health, a lot of people are not able to actually come into a facility. Stigma, many different, barriers exist, right? And so the thought was, okay, where does technology come into play? And can we get CARE, into people's homes, their offices, their communities, wherever they are at, right? And so we started looking at the landscape, and to be honest, we didn't see a good solution. And so we knew how to own and operate these things, and we said, okay, there's a lot of gaps that need to be filled, efficiencies to be realized. And so CARE, to your point, there's 3 main pillars. One is our direct-to-consumer pillar, which effectively allows anybody, any Albertan, right, easy access to mental health supports, right? And so they're able to utilize their, smartphone, their laptop, their iPads, and basically have access to, counselors, physicians that specialize in mental health, as well as specialists, psychiatrists. And so whether it's adult psychiatry or child psychiatry, which there's long wait times to see specialists in this province or in this country, right? And so our whole idea was to integrate that experience so that depending on the patient's needs, we will direct them accordingly. So that's our direct-to-consumer, component. We continue to build on those programs to really allow us to support each individual patient or user, whether it's a child, an adult, whether it's their specific conditions. Our second pillar is our B2B. That's our enterprise mental health offering.
Okay.
I would say that one, there's massive need for it, because if you look at, again, the last couple of years, right, this whole work from home, come back to work, oh no, go back to work, all right, go home, right? And so there's a lot of things that I think employers are looking for in terms of, solutions that, support their employees, right? And I would say in that area of enterprise health, it can be quite frustrating for employees where they say, okay, a lot of times it takes them a while to say, hey, I'm stressed out at work, or there's things I'm dealing with. Where do I reach out? It's actually quite difficult for them to navigate the system. Sometimes it's, pretty old school 1-800 numbers they're having to call. There's wait times, limited, support. So it's very, very frustrating. And as a clinician, by background, I know that's the last thing you want to do.
You're frustrated already.
Exactly. Let's make it harder for them. And so that, unfortunately, is what, is pretty standard in that area as it relates to employee mental health, especially. And so our whole focus is, because CARE Group's an actual technology company first and foremost, so we utilize our technology, create these, employee health hubs. And so effectively, an organization can upload our program. Each of their employees will have their own personalized employee or patient health hub.
Yeah, like a profile almost, right?
Absolutely.
Gotcha.
It's a profile and then a lot more. So basically, Bryce would have his own profile. You log in confidentially. You have access to resources, mental health resources, education. If needed, you can directly connect to a clinician, right? And so that, is one of the things that immediately changes the game, because you now are in control as the employee, right? And so no more waiting. And a lot of times it's not every incident or scenario requires a patient to talk to a counselor or a clinician. And so this way it gives you access to resources, and so again, going upstream, we want to be more preventative and kind of not wait until the issue is too severe. So that's a big piece of it. And so we can create these individual, employer-employee health hubs for each organization. So we're working with some very large, nonprofit and social community organizations behind the scenes right now. Working with a lot of companies that, have gone through a tough time in the past couple of years, but they may be scaling significantly. And you're talking about some of them have millions of users, right? Or employees, right? And so not employees, but users that utilize their platform. And so we want to plug in and offer that support to certain companies. And so that's kind of the enterprise side of things. And then ultimately, our third pillar is our technology company. And so we are a med tech company that effectively have created our own enterprise solution. And so to keep it pretty simple there, effectively what we do is we have a fully integrated virtual digital health solution that allows companies. So in terms of a company, you could be a hospital, you could be a clinic, you could be a nonprofit organization. So let's say you're serving 10,000 community members a year in children's mental health, right? Our question to that organization would be, well, why can't that be 20,000? Why can't that be 50,000? Well, it can, if you invest in technology and innovation.
They just don't have the physical resources.
Exactly. And I think it becomes a lot more efficient CapEx as well in terms of an investment. So if I'm running an agency, I might say, okay, do I deploy X number of dollars and build another physical facility, right? Which might have limitations in terms of how many people are able to access that facility. How do you facilitate aftercare versus, okay, let's invest in innovation and technology and build on the programs that we have, take that digital, right? And then effectively now you're able to, expand beyond your traditional geographical limit. You're able to serve more people. And then thirdly, there's a lot of support, right? If I'm an agency that have private donors or even, applying for grants or whatnot, there's a big focus on, innovation, use of innovation to become more efficient. And the reality is there's a lot of communities that don't have the ability to attract clinicians to go out to said communities, right? And so, so
Alberta has so many remote locations.
Yeah, absolutely.
Right? That don't have some of the facilities like you're talking about or the resources.
Yes.
So going virtual is kind of, I don't want to use the word no brainer necessarily, but it's kind of the path that is going to be the most effective and efficient, like we've talked about.
Yeah. And I think it's also, a way to be more upstream again, to be preventative, because, there's a lot of conditions, a lot of things that if we're able to get to people earlier, right?
Proactive as opposed to reactive.
Absolutely. And, some of the clients that we work with focus on, let's say, suicide prevention, right?
Gotcha.
And so, again, when you look at going back to some of our tools, you have that fully integrated experience. You can book an appointment, you can see somebody virtually, you can do the follow through. But because of the type of data that we're capturing, as well as the tech tools that we give you as a patient, you're able to track and trend a lot of different things. And so you might be able to track goals that you're working on, your medications, your mood, right? And so a lot of those things, if we see changes, right, in that, we can basically say, okay, something's going on, right? How can we offer support? Whether it's, offering some resources or offering a connection to a clinician. And so, to your point, it's definitely more efficient, but it's also, preventative. And the whole idea is if we can make a difference earlier on, get support, open that access to patients or communities, that's what we're all about, is using the technology to offer that sort of impact.
So do the solutions do your solutions make recommendations then to, say, a profile? Like, so if I have my own profile within the organization, and I've been tracking things, I've been doing maybe the tasks that it's been asking me to do to be monitored, will it actually make suggestions like you should reach out
It can,
to
yeah,
a
absolutely.
clinician or to a healthcare provider of this nature?
Yes, absolutely.
Okay.
And so our solutions are quite customizable,
Right.
Especially on that third pillar in terms of our technology solutions.
Yeah.
They are what's called, we can white label for organizations. So let's say organization ABC is serving geriatric patients. This one is serving youth. Each one may have different requirements. In fact, this morning, we're talking to a group out in Ontario that does basically it's a center for addiction, right? Where people check in for 2 weeks, 6 weeks, 8 weeks, all these different programs.
Yeah.
And so our technology can be customizable to that. And so now you're bringing all sorts of different elements and saying, okay, what's their diet like? What's their adherence to medications?
Yeah.
If somebody's taking opioids, how are you tapering them off, or how are you, and so there can be things programmed into there that based on this will make this sort of recommendation, or will suggest a consultation with said professional.
Right.
So a lot of that can be customized. Some of the things that we're doing that are quite cool, going back to that remote piece, is we're actually looking at certain partnerships with telecommunication companies, so telcos. I
was going to ask you about telehealth next.
Yes. And so there's a digital divide that needs to be bridged in certain communities. And so certain telcos are doing fantastic work to increase that. And so we want to work with groups like that to say, hey, why does it have to be where Ray sits down and turns on his TV? He gets YouTube, Netflix. Why can't there be a care opportunity for me to access remote care?
Gotcha.
Right? So we're working on some initiatives like that for sure.
Yeah.
Telemedicine is definitely here to stay.
Yeah.
I think it's going to become more and more, robust in terms of what type of offerings are on there. I think what's important for us, anyways, is really focus on ongoing supportive care, right? And so versus just, oh, hey, I just do a quick consult, because I have a skin thing or I need a refill. How can we be long-term providers and supporters of, people's health journeys? And I think there's that integration into mental health and then also physical health as well. And I think that's where having technology that's very agile, we have the ability to, look at the physical component as well. If somebody is saying, hey, I know when I get a good workout in or I go for a jog, I feel better mentally, right?
Yeah.
Why can't we have that integration into the telehealth or, the tools as well?
Right. Yeah. What are some of the biggest challenges you're seeing implementing this kind of I mean, I know you're going to get pushback. I know, we've heard this before where people say, "Well, it's just not personal enough because we don't get an actual face-to-face, or they just don't trust the technology, things like that." What are some of the challenges, the biggest pushbacks you're seeing, and maybe what are some of the opportunities that you're seeing that you can overcome those challenges?
Yeah, for sure. That's a great question. I think, traditionally, the medical community or medicine has been slow to adopt certain technologies, right? And I think, when you look at physicians, a lot of times they've been hesitant to adopt virtual care into their practice, and they didn't have to, right? Because they have a very busy practice. They're trying to keep up and do that great work. And I think with the pandemic, of course, there was that forced adoption. But I think, there will continue to be some challenges in the sense that a lot of practices operate on their own, right? And so there's different systems. There is some consolidation in the market. But I think, again, for a good telehealth solution, it has to be able to replicate what you experience in person. And I think there is, some ways to go there. So one is, the fragmentation of all these different practices, and there's a lack of interoperability in terms of systems, right?
Nothing's talking. The right hand's not talking to the left hand in some cases.
Right.
If you go see a physician over here, that recommends you over here, that physician might not have the data that this physician was supposed to hand over. The systems aren't talking in a certain way. So
That's right.
Becomes slow and sluggish in getting information passed on.
And that talks to the whole, the acute turnstile medicine thing. You're just trying to keep up, right? And I think, it takes, people being innovative and saying, okay, let's look ahead a little bit more and say, what does this look like? How do we start to bring people together and work together. And so I sit on a few different working groups, whether it's mental health or primary care. The whole idea is, okay, if we can start having those conversations, if we can start bridging maybe it's pilots and saying, okay, let's work on this set of patients from this practice or this organization, and we're focusing on tele-rehab, right? Or we're focusing on mental health, but we start having people explore that sharing of data, the sharing of technology tools, then I think that will start to gain traction, and we're seeing that for sure.
Yeah.
But there will be barriers. I think the other piece though is if you look at urban centers versus remote communities.
Yeah.
And so if you look at some of our partners, whether it's remote partners or indigenous partners that we're looking to create very specific solutions for, the reality is a lot of times. Again, those clinicians won't go to those communities. You're not able to get that regularity. And so one can argue, well, if we're using a digital solution, at least we're capturing data, we're giving people access to care, right? And then until we can build the infrastructure, to support that from a physical standpoint, the digital solution is definitely better than no solution.
Well, and it's
right?
fast. Like I had a gentleman I was just talking to the other day. He was up in Fort Chipewyan.
Yeah.
And I mean, at Fort Chipewyan, like you can't get up there unless you're on a plane at this time of year.
Exactly.
And so if you need some sort of assistance or medical care or even just a consultation of some sort,
right?
How and it's not available, how do you get it?
Yeah.
It's got to be digital. Like we've got the technology. It's just making sure that everybody is aware of the technology, utilizing it. And then if they need to adapt it, that's where you come in with your customization.
Yeah.
They can adapt it to what their methodology is and what works for their community and things like that.
Yeah, absolutely. Because I think it's finding the right pieces and the right solution, because a lot of times, and we saw this in the beginning of the pandemic, a lot of people are like, okay, I need to adopt, a digital solution so that I continue to see my patients. And so there's a lot of clinicians out there, a lot of organizations even that were quick to just take whatever they could so that they could continue care, understandably so. But I think it's, discerning what the different types of solutions are there. A lot of them are quite fragmented. Again, that's the issue with some of the piecemeal technology out there.
Yeah.
For us, we wanted to have a fully integrated experience so that, every aspect of, a clinician's ability to provide care, continued support for a patient on their side, they can access care, but then after they're done, they're able to get access to support. That I think is important to kind of think of the full picture. One example I always use is actually, so let's say I'm going to make you my doctor now. So Dr. Bryce, right?
Oh, you ain't going to make it.
so you're Dr. Bryce. I'm here to see you in person.
Yeah.
I'm in your exam room, or we do a digital consultation, right? You send me a Zoom link, something like that. I hop on. We have a great interaction, much like we're having now. I talk to you about certain things, and you say, hey, Ray, I want you to take these medications, right? Or I want you to work on these goals. Let's set some goals together. I want you to track your mood, right? A bunch of different things that you recommend to me.
Yeah.
The issue with this interaction, whether it's in person or digitally, the moment that interaction is done, I leave your room.
It's done.
It's done, right? I don't feel supported by you or the clinic. You have no idea what Ray's doing, right? And so the whole idea for us was to, okay, let's change that, right? And say, okay, the interaction, same interaction, Ray coming in, I've set up my profile. You know a little bit about me or a lot about me, depending on how much I want to share before the consult. This is all digital, right? We have that great interaction. After that's done, I have that portal to basically track and trend all the things that we talked about, right? So now I feel supported. You can send me some questionnaires. You can send me some resources. I'm tracking and trending my mood, the prescription compliance, how's my goals. I can diarize, capture, my thoughts. And then after the fact, well, guess what? Now you know exactly what I'm up to. I feel supported. And so that's just one example of how we change that traditional dynamic. And in a sense that, as you can see, that's probably a lot more, productive in terms of communication. For the patient, I feel supported. For you, you have better data, right? And so, a lot of times we're not having that happen, whether it's in person or virtually.
Yeah. What would be a milestone for your technologies, and I mean this group, it's a very cohesive group. I mean, they all support each other and work together in one way or another. What would be your milestone or your next milestone for the company?
Fantastic question. And for us, we have a lot of that mapped out. One, on our technology side, we want to become a tech partner of choice, for organizations when they want to create more, efficient, customizable solutions as it relates to digital health. I think we're doing really great in Alberta. We're expanding. We're having conversations, across Canada, some early stage conversations in the U.S. And so I think for us, it's becoming that tech partner of choice as it relates to digital healthcare, especially when you're talking about mental health, right? In terms of our B2B or enterprise side, it's really impact. So everything that we do, we want to do it for maximal impacts, societal impact, community impact. So for the B2B side, it's basically, of course we help small, medium enterprises, but right now we're already having large conversations with, multinational companies where they say, and again, that's the beauty of digital, is they say, hey, if you're able to create a hub for my employees, we can service different,
no borders.
Exactly. So I think for us, it's scale of impact, right? There's certain groups that we're talking to that have, based on their business, they have a very captive audience. Their audience can be quite stressed at times, and we're talking about millions of users. And so for us to be able to plug Care Group into that, and share resources, offer support, that's extraordinarily important and rewarding for us.
Do you ever have a challenge with onboarding clinicians and resources, like getting resources to sign on to be part of the program, essentially?
Right. Actually, I love you asked that question because I was in, or I still am in, the primary care space of physical clinics, right? And have been slaving away for a long time. It's very hard to recruit clinicians, right? And so I could build a shiny clinic across the street from where you're practicing, Bryce, and I say, hey, doc, because you are Dr. Bryce, come across, right? And it's very difficult because there's a lot of transitionary things. You got to change your address, all these different things. But with Care Group, it's actually been the opposite, right? Because virtual offers a very appealing lifestyle. Because you
can do it from anywhere.
You can do it anywhere. You can pick your own schedule. And so we have we're firstly blessed to have an amazing pool of clinicians, and that continues to grow. Every week, every day. And so a lot of times you have, I'll give you an example. So let's say a acute ER physician, right, that does a lot of work in the emergency rooms, and we have quite a few of those. And they say, you know what? When I'm doing what I do in the hospital, it's very high paced, right? Sometimes there's certain concerns that I'm not able to dig into a little bit more, right? Just by nature of the constraint of time. But with virtual, I can spend more time. I'm passionate about mental health. I want to do this. And so it perfectly augments, their work schedule. But we have people that, do it full time for us. But yeah, it's flexibility. You can do it, from home, as long as you have the right setup. And I think it's quite rewarding in that sense, right? Because a lot of times you're able to get deeper into those conversations and build those relationships.
Well, there's something about taking the coat off too, where you can be more personal. Like you take a wall down almost. Like I've talked to people that done sales too, and people that had to wear uniforms for sales always felt like there was this wall up. Right. As soon as they took their uniform off and they were in their casual clothes, they felt comfortable. Then, in turn, technically your customer or your interaction is a lot more comfortable, more natural, right?
Yeah, absolutely.
And so I feel like that could be something you talked about before off camera a little bit, of just people being more comfortable because they don't want to go into a building. They don't want to, maybe somebody might see me or something like that, right? They can just have that conversation naturally, from comfort with a tea in their hand, and get into the nitty gritty of it. And that's
so
nice
true
to see.
Yeah, so true. I mean, the white coat syndrome is a real thing. And I think, when you talk about mental health especially, absolutely. A lot of times people, for whatever reasons, they don't want to go into a physical facility, don't want to go into clinic, they don't want to go out in the public, right? So yeah, it's very comfortable, and you're able to have those deep conversations with them. And so, I think it's a very rewarding medium. And that's also how you program the tech too, to kind of elaborate on that a little bit more.
Yeah.
Like there are times when, if you're having a difficult conversation on video, let's say, if the patient feels uncomfortable, we can actually switch just to voice, right?
Yeah.
Or whatever the case may
Absolutely.
be. And we can just do chat, right? And so building something that's versatile, that again is patient-centric, is extremely important. For sure.
Absolutely. Ray, thanks so much for coming on and talking to us about this stuff and telling us more about Care Group of Companies. And if people want to find out more information, where is the best source of that?
Oh, great. Yeah, we have our main website, so www.thecaregroup.ca.
Awesome.
And then that actually extends into our 3 brands. easecare.ca is where you can access care directly. corpcare.ca, so corpcare.ca, is effectively our B2B. So if companies need solutions, right, they want to basically offer better support to their employees, that's where they go.
Gotcha.
And then our technology company is instacaretech.com. So instacaretech.com.
We'll have all that information down below for sure. So that's great. Yeah. Again, thank you so much for telling us about this stuff and giving us the insight. Try and get some people to reach out to you to find out more and get involved too. So
absolutely,
this is a huge thing, and it can only go up. It can only grow, and it can only get better. And you're one of the groups that is taking care of that, and making sure that it happens the best way, the most efficient way. So thanks.
Absolutely. Thanks for having me.
You betcha.
Thanks, Bryce.